Hi, I'm Dr. Christiane Northrup, an OBGYN physician and authority on everything that can go right with your body. And I'm here to tell you how to use this knowledge to transform your health and truly flourish. It's estimated that up to 60% of postmenopausal women suffer from what's called vaginal atrophy, a kind of awful word that just refers to thinning of the vaginal tissue, which, by the way, is reversible at any age. Many women suffer in silence due to embarrassment, cultural taboos, or not feeling comfortable speaking to their healthcare providers. But there are so many ways to avoid or reverse vaginal atrophy so that your sexual desire and activity does not need to decrease at midlife. So, what is vaginal atrophy? It is also a term used for atrophic vaginitis, another unfortunate term, but it's caused when there is a thinning, drying, or inflammation of the vaginal tissue in the vaginal walls, and this is often attributed to a decline in estrogen. It occurs most often during and after menopause. It can start as early as a woman's late 30s. It often happens after giving birth to a baby. There's a decrease in vaginal lubrication, and that's the early hallmark of hormone insufficiency related to vaginal atrophy. It's a chronic and progressive condition that can affect the quality of your life. What are the symptoms? They can include vaginal dryness, thinning of the vaginal walls, pain or burning, especially during intercourse, decreased lubrication during intercourse, spotting after intercourse, or a shortening and tightening of the vaginal canal. For many women, vaginal atrophy can also lead to urinary problems. It's all caused by a decrease in estrogen due to either perimenopause or menopause, removal of the ovaries, pelvic radiation, chemotherapy, medications, or hormones used to reduce estrogen levels. For instance, if you're taking tamoxifen for decreasing the risk of breast cancer, or any drug to decrease fibroids, drugs used to treat infertility, endometriosis. So the symptoms of genitourinary problems can be frequent urinary tract infections, urinary incontinence, burning with urination. Atrophic vaginitis increases your risk for vaginal infections and urinary problems. And although this is common, many women do not experience it, and many do. So what are the risk factors for it? Because not everyone has it. The risk factors can include smoking, and also decreases in blood circulation, and also effects on estrogen levels. By the way, not ever having a vaginal birth can increase your risk. Research shows that women who've not had vaginal births are more likely to develop atrophic vaginitis. Also, lack of sexual activity with or without a partner. You don't need a partner for this stuff. Okay, so what is the treatment? Vaginal atrophy is very common and it's very easily treated. So what are the two best ways to treat the condition? One, use a vaginal moisturizer, have more sex, and remember, sexual activity with or without a partner increases blood flow to the vagina, and the more blood flow, the healthier the tissue. It keeps the vaginal walls elastic and healthy. You may need a vaginal moisturizer in order to have comfortable sexual activity. There are many options for a vaginal moisturizer. I actually formulated one using Pararia mirifica, which is a phytoestrogen compound that restores vaginal integrity. Check out amatalife.com for that. It's a non-hormonal product. And so that's your first line. KY jelly, anything like that. That's your first line to use for that. And this is great for women who are concerned about the risk of an estrogen, even though, let me just tell you this, even prescription estrogen in small amounts put in the vagina does not put you at increased risk for endometrial or breast cancer, because it's such a small amount. But many, many women are afraid of it, and their doctors are afraid of it. Now, you might be sensitive or allergic to ingredients in over-the-counter vaginal moisturizers. Some contain warming agents, dyes, paraben, mineral oil, perfumes. So instead, try vitamin E capsules. You just puncture the gel cap and squeeze the gel into your vagina. You can wear a panty liner because sometimes gel can stain your clothing. Aloe vera is another natural option. It's both a moisturizer and a lubricant. It does not upset the pH balance of your vagina. Coconut oil, olive oil, those can help. Don't use these with condoms if you're worried about the condom breaking, because any oil can interfere with a latex condom. But be sure to test any product first on the inside of your arm before using it internally. So first, you try Herbal Remedies. These can be like my vaginal gel, or systemically, Pararia mirifica is an herb that can be taken by mouth, same with black quahash, donquai, or chasteberry. And these things change your systemic hormones, but they're plant hormones. They don't work the same as a mammalian prescription estrogen. So you don't need to worry about them and your health. So check with your healthcare provider if you're experiencing painful intercourse and it's not resolved by using the vaginal moisturizers that I talked about, because you may need a low-dose estrogen preparation. One of them is estriol vaginal cream, and that's available through formulary pharmacies. There's so much you can do. You do not need to suffer with this, because the vaginal tissue will restore itself, the term is cornified. It will become estrogenized, cornified very, very quickly, within a matter of just a couple weeks. So don't suffer. For more inspirational tips, visit my blog, exploredrnorthrup.com, where you will find wisdom for your body, mind, and spirit. Visit daily to discover the connection between your thoughts, beliefs, physical health, and life circumstances. And remember, you have the power to regain your health, and you have the power to make profound changes.